In the run-up to the UK election, we want to use this time to take you through our oral health manifesto point by point. We hope that policymakers take this opportunity to brush up on their oral health knowledge so that they can better equip the country with what it needs. Right now we're going to be discussing community water fluoridation.
I mean, we would call for universal water fluoridation countrywide, no questions. We have seen the absolute benefit of fluoride added to water. We've both grown up in fluoridated areas. We have little dental decay. I mean,
I've never had a filling.
You've never had a
I've
filling.
never
My
had
children
gum
haven't.
disease. Never.
No, I mean, I've got 2 fillings, but that's, I'm a darn sight older than you. But yeah, I mean, and that just shows how this works. You can talk about a lot of things that we that we give to people and say, oh, this will make you better. Universally, fluoride is the most life-changing because of the reduction in dental decay. So it means it's not it's sort of, it like covers all inequalities as well. It means you don't have to be rich to be able to have it because you've got to buy it. It's universal. You drink tap water, you're getting that protection. And it's so important in lots of areas in the country where we see huge amounts of children being admitted to hospital to have dental extractions under general anaesthetic at a really young age. And that pain and suffering that they've gone through, then they're going to not have any teeth until their adult teeth come through. Surely we need to look at this. In this day and age, we really shouldn't be having the amount of children that have to go through this just because they live in an area that the drinking water doesn't have fluoride in it, when we have absolute proof of how well it works. And I know we have the people who say, it's mass poisoning, etc. No evidence, no robust evidence to suggest any problems occurring through water fluoridation. But that's their prerogative. If they want to drink the bottled water, then fine. But we would certainly call for more widespread implementation of water fluoridation schemes across the UK. It's a no-brainer. Really
It's
is.
a simple thing that you can do without even knowing you're doing it to improve your health by stealth. And
oh, I like that.
I wish I'd coined it. It's quite a famous term, but I'll claim it for now. But
yeah,
honestly, because I'm a millennial, I get all my news from social media. But I did see a tweet, or I don't know what they're called now. It's on X, but a tweet from a dentist that said you shouldn't be having to make dentures for a 14-year-old. And
gosh, no.
that hit home for me because
No.
it's right. I mean, and you don't understand the impact that decay has on people.
Mm.
And if you can do one thing without even knowing you're doing it to help prevent it, I genuinely don't understand this. This is a no-brainer for me. This is one of the things on this document where I'm like, why is that not just done?
Well, because I think there is a lot of scaremongering out there, and then people start to believe it, and then they start to campaign against having the water fluoridation. I mean, we're talking about 1 part per million, 1 part per million, and it does so good. Now, there are places in the country that actually have natural water supplies that have fluoride much higher than that. Well, we're not going to take it out of their water, but they're getting more than if it was added to their water, because it doesn't need to be added, if you see what I mean. It's like you could be drinking fluoridated water without even knowing it. Your dentist will probably know because the fluoride rate in the area is probably lower than it is the national average. But these areas, we can see it. We look at the childhood decay rate, and we look at the number of hospital admissions, and we could probably make a map of fluoridated and non-fluoridated water areas. And I'm not even joking, we could do that because it's so significant. It's just, you could almost go like, well, that side of the road has it and that side of the road doesn't. You could tell because of the decay rates in the children. I mean, it's not a cure-all. I mean, we still need to brush our teeth, and we still need to, cut down on how often and the amount of sugar that we have. But it's just that little bit extra. It's like giving the enamel on your teeth a little suit of armor to protect it. It's just going to harden the enamel on your teeth, just make it a little bit more resistant to the rubbish that we throw at our teeth daily.
Yeah, I mean, to be honest, this is quite a simple one. Adding that tiny, tiny, tiny amount of fluoride to drinking water, we can see that it's going to improve people's lives, because those parts of the country that already have fluoridated water, we are from 2 of them. And when you look at that compared to the other areas, you can see it. I mean, you can physically see it. It's one of those things where there's no conjecture in this, really. It's just, we know it would help. So why
Yeah.
don't you do
Yeah. I
it?
mean, there is some worry about a condition called fluorosis, which is over fluoridated enamel on the teeth. They can appear mottled. It's really rare, and you would have to be having lots of fluoride in the water and eating toothpaste, really, to be getting any of that. So that's not a worry. And when you think the amount of money that could be saved by the NHS if we could reduce the number of hospital treatments, and days lost at school, days lost in work for people. People with toothache can't go to work. Children who have toothache don't go to school, so their parents don't go to work. It's such a knock-on problem.
Children being traumatized by the fact that they don't have
Totally.
any teeth.
If you are a child and the only time you go to the dentist is because you've got pain, you are not going to want to go to the dentist. Now, if you are a child that skips into the dentist and the dentist has beautiful teeth, every time you come, here's a sticker, you're not going to have a problem with going to the dentist for the rest of your life. And that's what we need to do. We need to get people early and make sure that all of the preventative measures that we know we've got, we can't argue about this one. We know it works. We have the robust evidence, plenty online about it, plenty. And we're living proof. What can I say? We're living proof.
Read the full manifesto on our website and get in touch with your local counsellor to see what they're planning to do to improve the oral health in your area. Next time, we're going to talk about bringing back oral health promotion teams in the community.